We are live.
Hi everyone, welcome to yet another lively episode of YouTube Live. I am Dr. Rajat Hazra, heading the medical content team at Practo to moderate this session. Today's session deals with the facts and myths regarding piles, and with me is an eminent specialist, Dr. Harsh Kumar. Dr. Harsh Kumar is the Chief General Surgeon at CMC Mohali since the year 2006. He specializes in and is dexterous in surgical treatment of piles and other anorectal diseases, apart from a multitude of other highly skilled elective and emergency surgeries. Before we begin this session, I would like to encourage the viewers to come out with their questions in the chat box only at the end of this presentation. So welcome, Dr. Harsh. Let us begin the session.
Thank you, Dr. Rajat. I would take this opportunity to share with my viewers the basic points of what piles is, what are the symptoms, and when should a patient sought a treatment. With your permission, I would like to share the screen, sir. I'll be
Sure, please
offline for
go.
just about 10 seconds.
Sure.
Yeah. So is the screen visible to each one of us? Hello, Dr. Rajat.
Yes,
Can you hear me?
yes, it's visible.
Yeah. Is the screen visible to all?
Yes, it's visible.
Yeah, fine. So, good afternoon, everyone. This is Dr. Harsh Kumar from Chandigarh, and I wish to share my views on what piles is all about. Now, piles, which are also called hemorrhoids or bawasir as they call it here, is basically a swollen unit of blood tissue in the lower anus or the lower rectum. If I am allowed to use the local dialect, it means swollen blood mass at the maldwar. Maldwar is what we call it here, the anus, the place from where stool is passed. So piles would present, normally piles are present 6 centimeters above the anal opening, and they cannot be seen by the patient, can neither see or feel the normal. It is a normally located tissue. It is a tissue which is present in each one of us. हम जब भी पैदा होते हैं हम सब में पाइल्स होती हैं. पाइल्स का एनाटॉमिकल सिचुएशन एक रीजन के लिए बना है, वो हमारे को कॉन्टिनेंस देता है. हमको जो हवा और स्टूल को रोकने की क्षमता है, दैट इज बिकॉज ऑफ द प्रेजेंस ऑफ पाइल्स. और इसीलिए पुराने टाइम में व्हेन पीपल अंडरवेंट द इन्वेसिव प्रोसीजर्स फॉर सर्जरी ऑफ पाइल्स, जो कटिंग सर्जरी होती थी, उसमें बहुत सारे पेशेंट्स कंप्लेन करते थे कि उनका कंट्रोल स्टूल पे और फ्लेटस पे, हवा पे नहीं रहा. विदाउट वार्निंग दे वुड पास. तो ये एक फोटोग्राफ है जिसके अंदर आई हैव ट्राइड टू शो, ये इंटरनल पाइल्स हैं. ये पाइल्स यहाँ पे, ये जो ब्लू कलर का टिश्यू है यहाँ से शुरू होते हैं. ये डिस्टेंस 6 सेंटीमीटर्स है. जब ये पाइल मास बहुत बढ़ जाता है तब वो फील होता है, और तब हम उसको हीमोरॉइड्स कहते हैं. और ये इंटरनल हो सकते हैं या एक्सटर्नल हो सकते हैं. एक्सटर्नल पाइल्स का इंटरनल पाइल से कोई कम्युनिकेशन नहीं.
Sorry to interrupt you, Dr. Harsh. वो जो आप
Yeah.
स्लाइड दिखा रहे हैं ना, it's not getting projected. जो internal piles up.
इंटरनल पाइल्स, ये फोटोग्राफ नहीं दिख रहा आपको?
No, I'm only seeing the first introductory this thing slide.
Okay, just give me a minute, sir. Just let me check क्या हो रहा है, sir. एक minute. I'm
Sure.
going offline for a second, sir.
Right, right. Right now it's visible. Right now it's visible.
Okay, just give me another minute, sir, please. Is it visible now, sir, Dr. Rajat?
It's visible. It's visible right now.
You can see the slide, the
Yes, I can
slide
see
on
this.
piles.
Yes,
Okay, now
yes.
I'm going to the next slide before I'll come back to this slide. Is the next, Anu, how do I go on the next?
Just click on the number 3 slide. It will take you. Or
It is
click
not
on the
coming.
arrow.
There's something wrong here, sir. Something.
Sir, I can help you here. If you can click on from beginning on top left from beginning.
Huh.
Yeah. If you can click here. And now, or if you go down on your right hand side, where you can see 44%, just next to it, there's a icon which looks like a glass, small icon, next to 44% on your bottom right.
Give me another minute, sir, please. I'm really sorry for this.
No issues, no issues. Fisher, this is not on full mode.
No, it's not on full mode. So if he clicks on the glass where it's written 44 seconds, it will go on the full mode.
Okay.
We are live though.
Are you sharing the screen? Okay. Sir, am I visible now, sir?
Yes, yes, visible. आप एक बार click करके देख लीजिए आगे पीछे.
नहीं आ रहा, आगे नहीं जा रहा ये. What do I do?
सर आपको उस पे क्लिक करना है, नीचे 44% दिख रहा है आपको, उसके बाजू में एक ग्लास है.
44%.
बॉटम में देखिए, हाँ 44%, उसके पास एक वाइन ग्लास जैसा फिगर है.
ऐसा मुझे कुछ भी नहीं नजर आ रहा है सर.
बॉटम राइट पे अगर आप देखेंगे तो नीचे लिखा है इंग्लिश यूनाइटेड स्टेट्स.
ये आपको मेरी स्क्रीन पे नजर आ रहा है सर?
हाँ जी.
अच्छा, मुझे नहीं नजर आ रहा है सर कहीं भी.
सर यहाँ नीचे देखिए क्लिक टू ऐड नोट्स लिखा है प्रेजेंटेशन के नीचे. क्लिक टू ऐड नोट्स. ये कॉमन अमॉन्ग प्रेग्नेंट वुमेन जो आप एग्जैक्टली नीचे देखेंगे तो क्लिक टू ऐड नोट्स लिखा हुआ है. प्रेजेंटेशन चला गया सर.
I'm sorry, friend. This is something. Can I just speak extempore, sir, on this?
Sure, doctor.
Sure.
Dr. Rajat?
Yes.
Dr. Harsh?
Dr. Harsh, you can begin. You are on mute actually.
Yeah, I know. Just give me another minute, sir. I'm just trying to sort this problem out. Next time. Yeah, I hope it'll work now, sir.
Yes.
So I was talking about hemorrhoids. So hemorrhoids or bawasir is present normally 6 centimeters above the maldwar. And it is present here when it only grows in size. Do we call it symptomatic piles, which people are aware of? And it is graded from 1 to 4, depending upon that size. I'll come to that later. Abhi jo main batana cha raha hu ki there are internal piles as shown by the cursor on this figure. And there's an external pile, which is actually a misnamed structure because it has got nothing to do with hemorrhoids. These are just normal venous structures present around the anal opening. And when these get injured, there is blood collection or thrombus formation, which is known as external piles. So this is internal and this is external. So we have two types of piles, internal and external. Internal piles, they require treatment. External piles mostly would be managed by medical management only. Again, it is not moving. Okay, anyway, so So there is something wrong with this. I'll just going for an extempore, sir. So
Yes.
what are the symptoms of piles? Now, internal piles would present only as painless bleeding. Now, you see, because the piles are present at a place which is 6 centimeters above the anal canal, and the dentate line is at 4 centimeters. Now, dentate line जो होती है उसके ऊपर there are no sensations present. So piles is a painless disease. Piles में कभी भी दर्द नहीं होगा. So patients who have internal piles would come and tell us that we had no problem, but we found the pot full of blood after passing stools. Now, this is what are the symptoms of internal piles. Besides that, there would be symptoms of itching, and pain would come only when the piles get complicated. Unless the piles are complicated, there would be no pain in patients of piles. While जो external piles होती हैं, external piles का जो reason है, that is basically a vein which erupts outside the anus and which leads to clot formation outside the anus, and we don't need to operate on these patients. Please give me another minute, sir. Okay, we'll try to work it out this way, sir. So this is okay. Coming to the frequency, am I audible, sir? Hello.
You are audible, and the presentation is also moving.
Yeah,
I think
fine.
it's
Thank you
perfect.
so much,
Please
sir.
go ahead.
We'll keep
Yes.
it this way, sir. So
Right.
frequency, they say that almost 70% of the world population today suffers from this disease of piles, and the peak age is at about 45 to 65 years. Although I have seen and treated piles in young adults between 20 and 30, but as an average, by 50 years of age, most of the adults would have experienced the disease of piles. Okay, so this is what I was talking about. This is internal piles and this is external piles. And external piles would look like this. This is what is a blood clot at the anus. Coming to the symptoms, it is itching or irritation in the anal region, pain or discomfort for external hemorrhoids, swelling around the anus, and the bleeding. This is about external piles. Coming to the symptoms of internal piles, usually internal piles would present only as painless bleeding during bowel movement. One might notice amounts of bright red blood on the toilet tissue or in the toilet. Now, when a hemorrhoid grows in size, you see, hemorrhoid, I would want to explain this to my viewers, that the bawasir is like a gubara, खून का गुब्बारा, and इस बवासीर की एक ब्लड सप्लाई होती है जो इसमें पंप करती है ब्लड. जितना ज्यादा पंप होगा ब्लड, उतना ज्यादा इस गुब्बारे का साइज बड़ा होता रहेगा. धीरे धीरे ये गुब्बारा मल द्वार के बाहर आ जाएगा. इट वुड प्रोलैप्स थ्रू द एनस रिजल्टिंग इन पेन. नाउ it is only when a hemorrhoid prolapses through the anal opening that it becomes painful. I repeat, painless bleeding is usually internal hemorrhoids. Now, how do we classify internal hemorrhoids? Now, grade 1 hemorrhoids would not come out of the anal canal. They would be present inside the anal canal, but remember, they have to get enlarged by more than 6 centimeters to come out of the anal opening, right? So hemorrhoids which are up to 6 centimeters in length and they bleed while passing stools are still called grade 1. Now, grade 2, when the size increases beyond 6 centimeters, these pile masses would come out during the passage of stools, but then without any effort, they would go back spontaneously. This is grade 2. The symptom of bleeding remains in all the grades. Now, grade 3 piles is when the size further increases, it prolapses out during passage of stools, and it has to be replaced inside. It won't go spontaneously. It has to be replaced. Grade 4 piles is when the blood circulation stops because the blood outside the anal opening, the pile mass which is present outside the anal opening, the blood clots in that part of the pile mass. You see, when a pile mass has prolapsed, part of the pile is inside the anus, part of the pile mass is outside the anus. Now, because the anal opening is a closed opening, so it leads to strangulation of this pile mass if it is not reposited back into the anus on time. So what happens? The blood here in the pile mass would stagnate and would lead to a thrombus formation, which would result in a permanently prolapsed pile mass. And this is what is called as the grade 4 pile mass. So those are the classification in to grade 1, grade 2, grade 3 and grade 4. Grade 4, also called as thrombosed hemorrhoids, would lead to severe pain, swelling, inflammation and a hard lump near the anus. Now this can also be present in an external hemorrhoid mass. So what I'm trying to imply here is that even when you have to differentiate between an external hemorrhoid and an internal hemorrhoid, you have to examine a patient. Now what is happening here is that a lot of patients would want to take treatment for diseases, for symptoms of bleeding and pain. I want to tell my viewers that there are at least 18 diseases, 18 different diseases in which the symptoms may be bleeding and pain at the anal orifice. And one of these diseases is the sinister cancer of the anal canal. So my dear friends, please do not go for medical management of these symptoms without having yourself got examined by a qualified doctor who can tell you. Once your diagnosis is made, you are free to choose the modality of treatment that you wish to take. जो treatment लेना है लीजिए, but पहले अपना diagnosis बनवा लीजिए. अगर diagnosis में गलती हो गई तो बहुत problem होगी. Now one of the questions that I am asked is, why does pile occur? What are the causes of hemorrhoids? Now, one is chronic constipation. You see, people here, my friends, are in the habit of carrying their mobile phones to the toilet. They would be checking all WhatsApp messages, all mails, and all kinds of WhatsApp and watching movies on this thing while sitting in the toilets. And this sitting for long duration on the toilet seat is one cause. Number two, straining during bowel movements. Now, what happened in say about 100 years back was the toilets were not present in households. और वो जंगल पानी वाली एक situation होती थी where the entire family before the sunrise used to go to the fields and defecate, open defecation. So the children and the ladies, especially because of social stigma, were not allowed to go for bowel movements during the rest of the day. So as a routine, the entire family would go down to the village, would go down to the fields and strain till they would empty their bowel. Now you see, now that we have places of convenience practically everywhere, trains, malls, hospitals, marketplace, homes, I mean, there's no need to strain during bowel movement. This is one major cause of causing piles. Now, having chronic diarrhea or chronic constipation, again, when the bowel movements are very low or very high, that can also lead to prolapse of the mucosa and increase in the incidence of constipation and piles. Being obese, yes, being overweight, because once you're overweight, the passage, the angulation of the passage of the anus changes, and that can again lead to piles. Then being pregnant, during pregnancy, because the gravid uterus presses down on the anus, increases the constipation and thereby the straining, that can also lead to piles. Eating a low fiber diet. You see, today we are following the Western world blindly. The diet which our grandmothers used to offer us is no more seen. We are into pizzas and things very rich in mirch and maida. And mirch and maida are two things which causes a lot of constipation, and because of constipation, piles would precipitate. Also, piles are seen in regular heavy lifting or sportsmen, army men, doctors who stand for long times, marathon runners and bodybuilders. Because of using heavy weights, there is a lot of pressure on the anal canal, and this is what leads to formation of piles. Having said all this, the etiology of piles is unknown. There is a genetic preposition also. It is seen in families. If the father has suffered, there is a big chance that the son would also suffer. But yet, as of now, we would basically say that faulty food and faulty bowel habits, these are the two main concerns for causing piles. Now, I said there are 18 different diseases which can lead to blood and pain while passing stool. So how do you make a diagnosis? Now, diagnosis is a rectal examination done visually and digitally. So the visual examination would tell us whether there are any fissures present on the anal canal. A digital rectal examination is when you put a finger inside the rectum and watch for any lumps or any thrombosed pile masses, because piles cannot be palpated. How do you look at piles? As I told you that the piles are present 6 centimeters above the anal opening. So the instrument of choice is a proctoscope. A proctoscope is nothing but a hollow metallic tube which is inserted painlessly into the anal opening. And if you have the facilities of a video proctoscopy, you can actually show the patient the piles. Now, normally a video proctoscopic or a digital rectal examination is surely embarrassing, but is definitely not painful. So patients who have the symptoms of pain or bleeding per rectum should not hesitate in getting a rectal examination done. Get your rectal examination done, get your diagnosis made, get the line of treatment, and then opt for the treatment that you wish to take. Now, how do you prevent piles? One, eat high fiber foods. Foods like salads, food like fruits with a pulp and the skin. Eating, atta which has the fiber in it. Drinking plenty of fluids. Consider fiber supplements if your diet is still inadequate. Spend as little time on the toilet seat as you can. Go as soon as you feel the urge. Since the toilets are present so close to you, do not wait or do not unnecessarily go and try to attend to the nature's call when you don't feel like. Well, morning hours you have to pass stool before you go to office should be really discouraged. You should go as and when you feel the urge to go. Exercise regularly. Mild to moderate exercise in the form of long runs or a long jog is the best way to keep your anal health intact. Avoid long periods of sitting. You see, a sedentary lifestyle would definitely lead to constipation, and avoiding a long period of sitting is one big help to prevent. No treatment, of course, grade 1 piles, if it is not actively bleeding, can be treated medically with the diet, changes in diet, changes in day-to-day activities. All said and done, the piles would never regress. The natural history of the disease is that grade 1 piles would go on to become grade 2, grade 2 to grade 3, grade 3 to grade 4, and grade 4 to grade 4 plus. The piles would never regress. Like if you have grade 3 piles today and you continue medical management, even after years, the grade 3 would never come back to grade 2. So once it has, the natural history of the disease is that the piles are going to exceed. So if you have minimum symptoms now and you've been diagnosed with piles, it is better to go in for a definitive treatment. Now, the definitive treatment have been used since the time immemorial, starting with rubber band ligation, electrocoagulation, infrared coagulation, sclerotherapy or the injection therapy, the conventional hemorrhoidectomy using blades and sutures, the hemorrhoid stapling device, the lasers which are so popular today, and the hemorrhoidopexy, the DG Hall RAR procedure, which I advocate to all my patients. Now, the procedures, rubber band ligation, electrocoagulation, they all have their details and is beyond the scope of my session here. What I'm sitting here for is that I want to tell my viewers the difference between laser and hemorrhoidopexy. Now, to the best of my beliefs, when my patients come for the laser technology, they are basically looking for a surgical procedure where minimum cutting has to be done. For them, laser is synonymous with minimal invasion of tissues. No, but that is not so, because you see, the laser light is just an amplified light. It burns like any other light. So if something is being burnt, how can that be painless? I use lasers for treatment of piles, but that has to be in conjunction with a better technique, which is actually non-invasive method, and that is what is called as hemorrhoidal artery ligation. Now, as I told you, that hemorrhoid is nothing but a balloon of blood, which is being pumped up by an artery. If we could block this artery, if we could block the supply to a pile mass, the pile mass would regress on its own. And because the blood supply is present in the insensitive zone, if we could take down this artery with this machine, which detects the blood flow to the piles, the pile mass would disappear without any surgical treatment. In other words, if we were looking for a non-surgical treatment of piles which could be performed under anesthesia, it was the Doppler guided hemorrhoidal artery ligation. This hemorrhoidal artery ligation causes a lower immediate postoperative pain compared with other treatments. It achieves similar immediate and long-term control of hemorrhoidal symptoms, and the complication of this treatment, including the recurrence rates, is much lower as compared to any other modality of treatment of piles. Yes, I'm Dr. Harsh Aggarwal. I live in Chandigarh, and this is my address for patients who can contact me through Practo surgical services. Thank you for a patient hearing. And once again, I'm really sorry for the glitch that we had during the presentation. I shall try and correct it in my next presentation. So thank you very much.
So, Dr. Harsh, thank you for the presentation. We have a couple of questions which our viewers would want to find out. These
Sure,
are
sir.
the frequently asked questions. Now, we will go, diagnosis and treatment wise. So, one of the questions is, Dr. Harsh, in earlier times, Indians used to squat during bowel movements. So nowadays, we have adapted the Commode method, and supposedly the anorectal angle changes, because of which piles can be a factor. I mean, this is one of the proposed hypothesis. Now, there are some YouTube videos advocating the use of a stool placed in front of a commode, so that instead of we can't go back to the squatting days, but we can convert the commode into a squat by placing our feet on the stool in front of the commode. How true is this fact medically?
Sir, if you are habitually constipated, usage of this tool definitely helps. But for a normal person who attends to the call of nature only when it becomes absolutely necessary, you see, I advise my patients that you must rush to the toilet as and when you cannot control it any longer. That is the time, and it should not take you more than 1 minute to evacuate. Now, the very fact that you are wanting to use a stool to pass, a wooden stool or a plastic stool to make your bowels move, what is the hurry? Why do you want to move the bowels? You see, as per the international definition of constipation is that if you are unable to move your bowels less than 2 times a week,
Right.
less than 2 times a week is the scientific definition of constipation. And this is in spite of a high fiber diet. हम जितना मर्जी पालक पनीर खा लें, हम जितना मर्जी मक्की की रोटी खा लें, we cannot reach that fiber level. It is 3 grams per day. So without, even after taking fiber supplements, if we are able to move our bowels twice a week, why should we be worried about moving bowels by using a stool and all? Jab aayega to, yes, you don't pass stools more than twice a week. Yes, you start listening to all these things. Yes, in patients who are chronically constipated, in patients, very elderly patients who get fecolates and for whom manual evacuation has to be done or enemas have to be given, which is a very painful situation. Yes, there is no harm yes, there is a concern about the angulation. We don't want those elderly patients to squat because of their knee joints. But yes, putting a stool at times helps. There are a lot of companies who are coming out with this. A lot of commercialization has been done. All that you need to do is just wear higher shoes, sit down on the pot. Normally, it is not required. For the normal population, it is definitely not required. The Western commode is a good place to pass tools on only when you absolutely need to go and attend. And don't be worried about, don't count the number of times.
Hopefully, sir, you answered a multitude of questions when you, responded. Because if you remember the movie Piku, the
Yes, sir.
elderly population are obsessed. I mean, I
Yes.
have, grandparents at home. When they don't pass, the second bowel movement in the evening, they bring the roof down. So I think you've aptly
Yeah.
answered that question that medically, it's two bowel movements a week, that too with
Yes.
high fiber diet.
Very true, sir. Very true.
Dr. Harsh, there's another question. If you remember, you spoke about the age group of having piles. And even
Yes.
though the textbook mentions something, the men in their fifth decade, men and women in their fifth decade, but in your private practice, you've come across younger population
Yes,
also.
sir. Yes, sir.
So my question is there a gender predilection? Is there कहीं ऐसे तो
No.
नहीं men में ज्यादा हो या
नहीं sir,
women में
नहीं.
कम हो?
नहीं sir, नहीं, नहीं, नहीं. I have not seen see, I'm sitting here with almost 16,000 plus surgeries under my belt, sir. I have operated on more than 16,000 pile cases already. I have not seen a gender predilection. No, it is equally present. You see, men are known for going out, doing laborious work, lifting weights, everything, right? But on the women, on the other hand, women are known to give birth to children. So
Right.
those two major factors come into play, giving them a 1:1 ratio in terms of incidence. So ऐसा कुछ नहीं है कि males में ज़्यादा है या females में ज़्यादा है. Males, because of their hard work, because of their strenuous work, they are more prone to this stress, anxiety, all that is there, right? But women, then they are in the childbearing age group. So most women would present to us with fissures post deliveries, and they are managed conservatively. They go on to develop piles because fissures, the pain of fissures makes them hold the bowels, and then that leads to constipation. Because you see, the last part of the rectum, only water gets absorbed. The ampulla of the rectum, just above the anal canal, the anal opening is just a few centimeters. Now, above the dentate line, whenever you're constipated, the stools stay in the ampulla of the rectum, and that is where only water gets absorbed. So, hard stool passage that precipitates a fissure. Now, anything, whenever a fissure heals, it decreases the girth of the anal opening, because anything that heals by scarring, the diameter would decrease, and then that is how it becomes a vicious cycle. Well, to answer your question, sir, I have not seen a sex predilection, gender predilection in my practice at all,
Right. Right.
sir.
Dr. Hers, एक और question is that you are aware the region is such, the anorectal region is such that many a times both men and women are embarrassed to approach a doctor.
Sir,
So, is there a possibility that at least external piles can be self-diagnosed, or do you think it's a risky proposition? well,
see,
आज के ज़माने में
sir,
आज के
बहुत
ज़माने में
बहुत
कोई भी
risky.
Google's पढ़ ले तो Google, they'll
Hmm.
go to the Google and they'll think that if they have got piles.
No.
I mean, is it a risky proposition, or do you suggest that maybe they can do so?
No, Dr. Rajat, I'd like to answer this question with two different perspectives. You see, what is happening is there are a lot of pile clinics which have opened up today, and they are doing pile surgeries for probably every patient that walks in at a throwaway price. You see, because the piles happen to be on the posterior half of your body, you cannot see them ever. So, diagnosing piles, self diagnosis based on the symptoms is absolutely uncalled for. That is number one. Number two, as I mentioned during my presentation, that there are 18 different diseases which can present as a lump, pain, and bleeding. You see, a mass which is coming out could be a cancerous mass, it could be a cancer. It could be a what? It could be a condylomata. There could be bleeding in an inflammatory bowel disease patient. These are serious matters which need to be looked into. Now, while patients are aware that piles के लिए दिखाने गए तो surgery होगी. Surgery used to be very painful till about 20 years back. Number two, you can never see whether you actually have piles or not. So the scare of the people leads them to shortcuts. You know, they would go and take medications from the other traditions of medicines. And my question to these patients is, did someone examine you before giving you these medicines? Unless a patient is examined by another person, you cannot examine your own anus or your rectum. It's impossible. So self-diagnosis should be seriously discouraged. There might be a 10% chance of another disease, but that it exists, and it can be very dangerous if you miss a bad disease in the early stages where it could be completely cured. Like, let's talk about a cancer. You see, a cancer would present as painless bleeding and constipation. You think of that this is piles, you go to quacks for that matter to get your treatment done. You're given certain medication that give you laxatives. You start passing stools normally, the bleeding stops for some time and you're happy, but in the meantime your cancer grows. So if you have this problem, it is best to get yourself examined. And that is the reason why me and my colleagues around the country who are doing a genuine pile practice, we are using video proctoscopes. The video proctoscopes, the patient can directly see what is happening inside. The patient is given a video clip of his video proctoscopy so that he can go for a second opinion or a third opinion. An observer error always exists. Something that looks to me like grade 3 piles may look like grade 4 or grade 2 to another surgeon, or he may think, no, this is something else. Yes, that is clinical misjudgment, that is allowed. But then when you're giving the video clip to the patient can always go for a second. That is what we are practicing in our institute. What we are doing is we are doing a video proctoscopy. We give it to the patients. We send them on WhatsApp, and they are allowed to go to consult any government, any hospital, or any doctor in private practice or government practice, and then confirm the diagnosis and then get treated. But yes, self-diagnosis or that half uncooked knowledge that they get from Google can be very, very dangerous. I have seen patients suffering, and I would strongly advise my viewers not to indulge in self-diagnosis when it comes to anything relating to your anus and rectum.
There are other questions also regarding the treatment.
Sir.
So many a times you must have noticed, patients having a categorical concept in their mind that piles ho to surgery, only medical treatment say we can avoid surgery. But as I understand, you have spoken about 4 different types of piles.
Sure.
I think, probably the treatment, both medical and surgical, will vary depending on the types of piles. Can you please, हालांकि आपने बता रखा है पहले, can you please just, emphasize this to our viewers that there is no single magic bullet or magic wand in the form of a surgery to, cure piles?
No, sir, see, piles has to be managed depending upon the symptom score. The grading of piles has got nothing to do with treatment. A grade 1 piles can make a patient bleed to anemia, while a grade 4 piles present over the past 20 years may not give any problem to the patient. So the treatment has to be tailor-made for each patient. I get phone calls from across the country, sir, we have grade 2 piles, we have grade 3 piles. Iska kya treatment hoga? I said, come and show me. So you see, a patient with just grade 1 piles who is actively bleeding has to be managed surgically. And at the same time, a gentleman who's 85 years of age has grade 3 piles, which is not bothering him. His mucosa is supple. There is no bleeding which is happening to him. He's passing stools normally. Or even if he's constipated with stool softeners, if he can be managed, fine, we would not opt for. So we have to warrant a surgical treatment which would cure the patient of his problem. See, losing blood, as I said, piles is painless bleeding. So if piles are bleeding, you have to manage it conservatively. Initially, you can give drug like tranexamic acid or flavonoids or lubricant for the anus or stool softeners, if you try and the bleeding stops, and if you are managing his hemoglobin levels every 1 month and see if hemoglobin is not dropping, you can continue to manage the patient conservatively. But in case the bleeding continues or the patient continues to lose blood, if he's getting anemic or he's passing blood which is seen. Now see, there's another thing. There is something called visualized blood and occult blood. At times, pile would release such a small quantity of blood that it would be hidden inside the stool mass. It would not be seen. That is what we call as occult blood. But spread over a period of 3 to 4 months, his hemoglobin levels would fall by say 2 to 3 grams. So if you've had bleeding piles, if you want to manage it conservatively, you need to monitor your hemoglobin levels. If your hemoglobin levels are stable, they are at a healthy 13, 14, there's no need to opt for a surgical this thing. But there is another consideration. You see, something which is, as I said, the natural history of the disease is the pile masses are going to grow from grade 1 to grade 4. Of course, I'm not talking of the symptomatology. Now, if the pile mass is going to grow from grade 1 to grade 4, why make important things urgent? You see, if you have a gentleman at 70 years who has a grade 3 pile mass, it is not bleeding. Now, another 10 years, maybe he would not be as fit for anesthesia as he is today. And if you're sure that he's going to get a grade 4, so you see that life expectancy, you see how much the patient is going to live, what is the patient's lifestyle, what are the chances that these pile masses would start bleeding. So it is in our practice, we offer surgery for a patient who has symptomatic piles, put him on medical management only when he refuses any kind of surgical treatment, but we warn him that this problem might escalate in the future. Medical management as such only has role in grade 1 and grade 2 piles, provided they are not bleeding. Provided they are not bleeding, because smaller, even normal sized piles, we've had to treat even normal sized piles at times when the size is not big, but the arterial supply, patients of portal hypertension, patients with inflammatory bowel disease, when the pile mass would start bleeding without warning. And the best part of DG Hall is this procedure that I perform, which I advocate. I do all these procedures, but I advocate these procedures because there is no cutting involved at all. We are not invading. Koi chaku, koi कैंची, कुछ इस्तेमाल होता ही नहीं. So even patients with inflammatory bowel disease and with the liver cirrhosis, with portal hypertension, liver patients, in the place where I live, Punjab, we are known for drinking a lot. So I get a lot of patients with liver diseases and piles. And you cannot do any kind of other, you can't perform lasers on them, you can't do staplers on them. So DG Hall is a boon for such patients. So I don't advocate I don't advise surgery unless it is absolutely necessary. But I'm not happy with the long-term results of medical management either. Patients with piles who had this, they would come back 6 months later, 8 months later with complications and would ask me for surgery. So that has been my personal experience. I don't commercialize surgical treatment of piles. If it can be avoided, it should be avoided.
So,
Right?
Dr. Harsh, just to emphasize the point for our viewers, there are a couple of points. One point that you are suggesting is that prevention or precaution is better than cure. ऐसे
Definitely.
ना हो that you are suffering from grade 2, grade 3, which can be managed at that age. आपने वो 10 साल खींच लिया, but you've come at a point where probably you are no longer fit for a surgery. तो
Very true,
एक
sir.
ये point हो गया. Number 2 point is there is no single shoe which fits all. So
Very
it
true.
is based on your clinical experience and discretion, you will customize it for that particular patient, depending on age, other underlying medical conditions, etc., etc.
Very true, sir.
And third is, I mean, people somehow seem to be obsessed with 1 or 2 surgeries, which they tend to pick up either from a WhatsApp group or a neighbor who's undergone, or Google, and they think that's the ultimate cure. There also, you are demolishing the fact that there is nothing like a best surgery.
Very true.
There are So you are advocating a particular surgery called HAL surgery. Who knows, tomorrow, 10 years from now, we'll have a better surgery. So
Definitely,
people
sir.
have to keep their mind open. These are the
Very,
3, I think, take-home messages for viewers.
very true,
So
sir.
there's a group of other questions related to surgery. So
Certainly.
one question is, how painful are these surgeries? Are there any complications? And what is the frequency of recurrence of piles after surgery?
Fine. So you want me to answer this in the context of the DG Hall that I've talked about, or the pile surgeries? Because that would be a very long answer then.
Yeah, probably, since our viewers are obsessed with laser, maybe
Okay.
you can talk, you can highlight laser as well as the HAL surgery
Okay,
as well.
fine. So let us have a quick comparison. I have been using lasers now for the past 10 years, and I've been using Doppler guided treatment also for the past 10 years, right? So they came into being together, and we've been using both these kind of procedures. Now, given a choice, I would want to do the Doppler guided hemorrhoidal artery ligation. It is definitely a better procedure in my hands. I am not generalizing. There are surgeons who are HAL surgeons, but laser surgery cannot be successful beyond a particular grade of piles. While DG Hall, the Doppler guided surgery, this can be done from grade 1 to grade 4 plus any grade of piles. Number one. The Doppler guided surgery can be even done for patients who have recurrence of piles. Now, coming to the recurrence, the incidence of recurrence is definitely more in patients with lasers as compared to the Doppler guided Hall procedure. Why? Because we are only looking after the pile masses in cases of laser. See, laser is simply that you put a burning stick inside the pile mass and burn it off. You're not looking at the blood supply. What we are doing in Doppler guided surgery is we are looking at the blood supply and switching off what is causing the piles in the first place. But then, as I said, you see, a patient is not born with piles. There is something that has happened to him during his lifetime that has caused piles. So if he could get piles in a perfectly healthy body, why can't he get piles in a treated body? So coming to the incidence, it is less than 3 to 4%. In my 16,000 cases, I've had recurrence in 32 cases, sir. I have a patient log. 32 patients is less than 1%. Normally, the data says that it is about 3 to 10% in the Doppler guided surgery. I can easily assure of less than 3% in all trials that I and my friends have gone through. Coming to the pain, sir, since if you are talking of only Doppler guided hemorrhoidal artery ligation, there is a single absorbable stitch which is put up above the dentate line. This surgery is practically painless. My patients, they drive back their car after 4 hours of surgery. It is done under caudal anesthesia. And if a patient has recovered completely in terms of having passed urine with complete motor activity, if my anesthetist allows movement, these patients are sent home the same day. That is one thing. Yes, if we have to do a rectoanal repair also for grade 4 piles or grade 3 piles, where you have to combine the ligation with a mucopexy, where you have to, plicate the mucosa to decrease the prolapse, that is slightly painful. Otherwise, the only,
Dr.
yeah,
Harsh, sorry to interrupt. If you could, just break it up into layman's language,
fine, fine.
mucopexy.
Okay, okay.
Yeah.
I'm sorry, Dr. Rajat. I just
No, no, no,
wanted.
no issues, no issues.
Yeah, so DG हाल जो लेजर ट्रीटमेंट है, लेजर ट्रीटमेंट जो है वो ग्रेड 1, ग्रेड 2 और कुछ ग्रेड 3 के पेशेंट्स में किया जा सकता है. अगर पाइल मास रेक्टम के बाहर पड़ा हुआ है तो उस पे लेजर ट्रीटमेंट आप नहीं कर सकते. तो वो लिमिटेशन है. दूसरी बात ये कि जो लेजर ट्रीटमेंट है वो एक जैसे हम लोग वेल्डिंग करते हुए एक आर्क लाइट की होती है, शार्प लाइट होती है, उस तरह से हम लेजर को इंटेंसिफाइड लाइट कहते हैं. तो लेजर जब जाती है वो अंदर से उसको पाइल मास को जला देती है. तो वो दर्द होता ही होता है उसके अंदर. उसमें ऐसा कुछ नहीं है कि उसमें पेन नहीं होता या उसमें दर्द कम होता है. वो पेनफुल ट्रीटमेंट है. जो डॉपलर गाइडेड ट्रीटमेंट है उसके अंदर हम पाइल मास को हाथ ही नहीं लगाते. हम पाइल मास के ऊपर जाके एक तरह से उसकी जड़ जो है वहां पे जाकर उसकी ब्लड सप्लाई को बंद कर देते हैं और पाइल मास अपने आप खत्म हो जाता है. जैसे एक गुब्बारे में हवा भरती जा रही है, आपने उसकी हवा का सोर्स बंद कर दिया, बाकी की तो फूला हुआ गुब्बारा आप 3 दिन घर में टंगा रहने दीजिए, बर्थडे पार्टी वाला, 3 दिन बाद उसकी हवा अपने आप निकल जाती है. तो इसी तरीके से जो पाइल मास को हम छेड़ते नहीं है, तो जब छेड़ते नहीं है उसको तो कोई कटिंग इन्वॉल्व नहीं है, तो इसके अंदर दर्द जो होता है वो सिर्फ जो मशीन अंदर जाती है, डॉपलर मशीन, वो भी अंडर एनेस्थीसिया, उसका थोड़ा सा डिस्कम्फर्ट होता है। अब ग्रेड 4 को जब हम ट्रीट करते हैं तो हमें एक स्टिच और लगाना पड़ता है जिससे कि ये पाइल मास बाहर से अंदर चला जाए। उसके अंदर हल्का सा दर्द डेफिनेटली होता है वो, लेकिन जो दर्द है ये टोटल दर्द की ड्यूरेशन 7 से 10 दिन की रहती है और 3 हफ्ते में ये दर्द कंप्लीटली खत्म हो जाता है। अब ये सर्जरी आपने ओपन करी है, चाहे लेजर से करी है, चाहे आपने किसी से भी करी है, वो 3 हफ्ते का दर्द रहना ही रहना है। लेकिन डॉपलर गाइडेड ट्रीटमेंट में अगर आपने ग्रेड 3 तक ट्रीटमेंट करा है तो पेन सिर्फ 1% रहता है, सिर्फ 1% पेन होता है। पेशेंट दूसरे तीसरे दिन से काम पे जा सकता है, कोई दर्द नहीं होता। हाँ, अगर आपने उसमें ग्रेड 4 को कराया ऑपरेट तो फिर ऑफ कोर्स आपको उसमें 3 हफ्ते तक डिस्कम्फर्ट रहेगा। इसीलिए मैं अपने पेशेंट्स को सजेस्ट करता हूँ, डोंट मेक इंपॉर्टेंट थिंग्स अर्जेंट। अगर आपको पेनलेस ट्रीटमेंट पाइल्स का चाहिए तो टाइम रहते उसको करा लो। आपको ब्लीडिंग हो रही है, ग्रेड 3 पाइल्स है, आपको अपने वीडियो प्रोक्टोस्कोपी पे देख लिया कि आपको पाइल्स है, बगैर इस बारे में सोचे कि रेकरेंस होगा कि नहीं होगा, बगैर इस बारे में सोचे कि मुझे पेन होगा कि नहीं होगा, अगर ग्रेड 3 तक है, डॉपलर गाइडेड ट्रीटमेंट से बहुत मामूली सा दर्द होता है, बहुत मामूली सा डिस्कम्फर्ट होता है। हाँ, जहां तक रेकरेंस का सवाल है वो लेस देन 3% है 100 मरीजों में। कोई 3 मरीजों को किसी कारणवश अगर रिकरेंस होता भी है तो बात वही है कि इट इज लाइक समथिंग लाइक कि मेरे को अभी बुखार है, मैं क्रोसिन तभी खाऊंगा अगर मुझे अगली बार बुखार नहीं हो। नहीं, वो सोचना गलत है। आप अभी का ट्रीटमेंट करिए एंड प्रे टू गॉड, अपना डॉक्टर से एडवाइस लेके अपने लाइफस्टाइल को मॉडिफाई करिए, जानिए कि ये मेरे को क्यों हुआ था, उस चीज को अवॉइड करने की कोशिश करें, पर टाइम रहते उसका ट्रीटमेंट करें। दैट हैज टू बी ट्रीटेड। सो लेजर्स, जहां तक मेरा ख्याल है, हमारे जो व्यूअर्स सोचते हैं कि लेजर में दर्द नहीं होता, ऐसा नहीं है। अगर मैं कंपेयर करूं लेजर को डॉपलर गाइडेड ट्रीटमेंट से तो जमीन आसमान का फर्क है दर्द में। लेजर बहुत पेनफुल है। आइस, हम लोग आइस रखते हैं सर्जरी के बाद, लेजर से करने के बाद इतनी हीट पैदा हो जाती है। जब इतनी हीट पैदा होगी तो दर्द कैसे नहीं होगा, दर्द तो होगा ही होगा। जबकि डॉपलर गाइडेड के अंदर कोई कॉटरी नहीं इस्तेमाल होती, कोई कैंची इस्तेमाल नहीं होती, कोई चाकू इस्तेमाल नहीं होता, कोई किसी तरह का करंट इस्तेमाल नहीं होता। सिंपल सी मशीन जाती है अंदर, मशीन जो है वो आइडेंटिफाई करती है। मैं इस चीज को एडवोकेट करता हूँ कि ये एक्चुअली नॉन सर्जिकल ट्रीटमेंट ऑफ पाइल्स है। जो डीजी हाल है उसमें इतना कम इन्वेजन है, कोई कटिंग नहीं करनी, कोई चीरा नहीं लगाना, कोई कुछ नहीं करना, सिर्फ आर्टरी लोकेट करके आपने बंद कर देना। तो जो वो है लेजर का, सही मायने में अगर आप ये मांग रहे हैं कि नॉन इन्वेसिव मेथड है, तो सबसे जेन्युइन नॉन इन्वेसिव मेथड जो है दैट इज डॉपलर गाइडेड ट्रीटमेंट, नॉट द लेजर ट्रीटमेंट, नॉट द स्टेपलर ट्रीटमेंट, नॉट द क्रायोसर्जरी, नॉट द स्क्लेरोथेरेपी। सो डीजी हाल इज एक्चुअली द जेन्युइन नॉन इन्वेसिव ट्रीटमेंट फॉर पाइल। सबसे कम दर्द, सबसे कम इन्वेजन, सबसे लेस कॉम्प्लिकेशन रेट, सबसे लेस रिकरेंस रेट एंड वंडरफुल रिजल्ट्स। ऑन टेबल आपकी पाइल्स डिसअपियर हो जाती।
राइट डॉक्टर हर्ष, एट दिस स्टेज एक और सवाल पैदा हो रहा है, हालांकि यू ऑलरेडी आंसर्ड दिस क्वेश्चन, आई मीन इन योर रिस्पॉन्स जस्ट नाउ, that you know our audience would also want to know what is the recovery time. आपने कहा 3 weeks, and how soon can they join back work?
Sir,
I mean, probably you went for laser. It will depend varying on the surgery, if I'm not mistaken, as well as the grades, right?
So I'll because for the past many years I have been promoting this procedure because I find it a wonderful procedure. So DG Halsa, as I said, my patients, they practically drive their car back home on the same day of the surgery. You see, when I do camps, I do almost 40 surgeries a day. By the time I finish, I would have discharged some 32 to 34 patients. And because of the time, I discharge the rest the next morning. And they can practically join back office after about 3 days. Most of them are allowed to join. Yes, if unless it is grade 4. अगर grade 4 को आपने ऑपरेट करा है तो देन अगर आपने म्यूकोजा को स्टिच करा है, जहां पे स्टिचिंग करनी पड़ती है, वहां पे हल्का सा डिस्कम्फर्ट रहता है स्टूल पास करते हुए। वहां पे आई वुड से 7 to 10 days एट द मैक्स। 3 वीक्स जो मैंने आपसे कहा था, 3 वीक्स में तो पेशेंट क्लिनिकली वीडियो प्रोक्टोस्कोपी पे या सिम्टम वाइज कुछ भी नहीं रह जाता, खत्म हो जाता है सारे सिम्टम्स 3 वीक्स के बाद। तो आई अलाउ देम, सी आई आल्सो एम इनटू मेडिकल टूरिज्म, तो मेरे पास पेशेंट्स आते हैं यूएस से, ऑस्ट्रेलिया से। दीज पेशेंट्स कम टू मी एंड दे फ्लाई बैक आफ्टर 3 days। आज वो आते हैं, आज उनका वर्कअप होता है, कल उनकी सर्जरी होती है, 48 आवर्स के बाद एक रेक्टल एग्जामिनेशन करके दे आर अलाउड टू फ्लाई बैक सर। कोई ब्लीडिंग
Okay.
नहीं, कोई ड्रेसिंग नहीं करनी, कोई आपने पेशेंट फिर से दिखाने नहीं आना, आपको सिर्फ एक ऑइंटमेंट लगाना होता है, एक स्टूल सॉफ्टनर और एंटीबायोटिक्स 5 दिन के लिए, दैट्स इट। कुछ प्रिकॉशंस होती हैं जो हम रिगार्डिंग कॉन्स्टिपेशन एंड स्क्वाटिंग बताते हैं, but that is practically all, and the procedure time is just about 8 to 10 minutes.
So, doctor, we've come a long way. Probably 15 years ago, even 10 years ago, these kind of things were unimaginable.
Yes,
The
definitely.
place where we have reached now is definitely much more comfortable and definitely relatively pain-free when compared to earlier times.
Definitely, sir. I totally agree with it. Piles is no more that surgery where you need to be scared. And the
Right.
social stigma attached along with it has to be, because it's your body. The anus or the piles is just another part of your body.
Exactly.
You should not hesitate in getting yourself examined. And of course, you can plan your treatment. Mostly, there is no panic regarding the timing of the surgery. So you see, we have a waiting list of weeks, where we can. So normally we pick up patients. If somebody has come to us with grade 4 prolapse, we know that if we don't operate on this patient, he may end up with thrombosis of the external mass. So otherwise, we have a schedule fixed for patients who walk in, they get worked up, and if we are sure that this is piles and nothing else, we offer them surgery, sir, or any
Right.
other treatment that they require.
So, doctor, since we are talking in terms of surgery, which are the alarm signals or warning signals which a patient should not ignore immediately after the surgery once he is back home?
Sir, any kind of bleed after the first 3 weeks of surgery,
Right.
any kind of bleed that happens after 3 weeks of surgery, any kind of prolapse that happens after about 2 months of surgery, and any kind of thrombotic pain, pulsatile thrombotic pain that the patient, sorry, not thrombotic, throbbing pain, any kind of pulsatile throbbing pain that the patient has. These are the warning signs. But in my experience, all this would happen. If a complication has to occur, it would happen in the first 3 weeks. If there is anything like a secondary hemorrhage or any kind of infection, if you've passed the first 3 days comfortably, and that is the reason why I allow my international patients to fly back home after 3 days. That is the reason, because I know if everything has gone fine. See, surgery is not without complications, and no surgery is a small surgery. If I said that I've had no complications, I would either be lying or I'm not working at all. So if I'm working, if I'm doing a volume of patient, there has to be surgery. But anything that happens would happen in the first 3 days.
Right. And anyways, doctor, surgery is not something which is very natural and normal.
Very true.
I mean, you need to have a disease in order for the surgery to
very true,
go.
sir.
Right.
So we are fiddling with the creation of the Almighty. You see,
Right.
the nature has to get back to us. It has to come and bite
Right.
us. For some. So unless we are very, very careful about what we are doing and ethical about what we are doing, you see, we would always
Right.
bite the dust. So, but if let me assure you, sir, ये जो DG Hall procedure है, I have seen practically zero complications so far.
Right. Right.
Zero complications. I mean, such a beautiful procedure, such a wonderful procedure. God forbid if I get piles in my time, I would go for this procedure for my treatment. But what more can I say? It is such a wonderful procedure.
Right. Right.
Yeah.
And doctor, I mean, it's been a pleasure talking to you. There are still a couple of, myths and facts, even though you have, cleared up a lot of myths and facts throughout the presentation. There are a couple of myths and facts. For example, one of the viewers is of the opinion that, people with piles should avoid exercises. Is it medically true, or, I mean...
No. I just mentioned that constipation has a big role to play, and regular mild to moderate physical exercise is one key to good health, good anal health. So yes, if you're talking of exercise in terms of lifting weights, building body, yes, that has to be avoided. That should be avoided at least post surgery for the first 2 months. But you know, a lot of professional bodybuilders and gymmers, they come to me for these surgeries. That I was talking about my share of younger patients. So these are the patients who are into, you know, they are into drinking this lot of protein shakes and all that. I seriously, you know, advise against all this. But after surgery, they are told to take precautions for the first 2 months. And beyond that, once the natural healing has occurred, the healing modulation has taken place, they are allowed to any kind of gym activity or any kind of training again. So yes, physical exercise should be done in moderation to avoid constipation. It will actually help. Patient with grade 2, grade 3 piles should not do anything that causes straining, like lifting weights or going for a 100-meter sprint, you know, or doing squatting with, you know, leg weights and all that. No, go for a simple jog, go for a simple long walk. It is the best exercise to get rid of constipation. So no, exercise, you can't, in today's world, in this competitive world, you have to keep healthy by exercising regularly, sir.
So the bottom line of what you're trying to say is anything in moderation. Too much of exercise might have a deleterious effect.
Very
And
true.
at the same time, sedentary lifestyle will create constipation and start a vicious cycle.
Very true.
So another question that comes to mind in relation to this is stress and high blood pressure causing piles. Is it a medical fact or a myth?
No, it is a myth, sir. Stress and hypertension, they will not cause, you know, it will not cause piles per se. But you know, a patient who has stress would not sleep properly, right? If he doesn't sleep properly, he would not eat properly, he would not exercise regularly. That would all lead to constipation. And constipation, as I said, is the primary factor, whatever cause, whether it is genetic or you know, certain disease with the muscular system, whatever. But any form of constipation will definitely predispose to piles. Hypertension, no, because these are end arteries. A hypertensive disease would not reflect on this. I mean, per se, hypertension would not cause piles.
So what you are insinuating is probably stress indirectly will set a cascading set of events which ultimately may lead to constipation.
Definitely, that's right.
So it's a dominoes effect of probabilities. It may or may not. So it's not a very mandatory situation that you are talking about.
Yeah, very true, very true. Sir.
Yes.
Stress has a role.
Yes, go ahead. Sorry.
Please carry on, sir. Carry on.
So, no, that's what I was trying to emphasize for the viewers, that I mean, these lie in the gray areas. I mean, the stress causing, I mean, they may not have a direct effect, but as you rightly pointed out, probably it will set a set of events which might lead to constipation, and that may lead to aggravation of piles.
Very true, sir. That's exactly what happens.
And before we bring it to a close, one last, maybe it's an observation or statement. I don't know how to put it across. What suggestion do you have for working professionals in order to prevent piles?
My suggestion as an elderly is go slow. Enjoy your life. Khani dal roti hai. Don't run after professional excellence. Yes, professional excellence has its own charms, but don't get into the rat race. Lead a disciplined, simple life. We are working to live. We are not living to work. So professionals, please enjoy the work that you are doing. Maintain a healthy lifestyle. Don't take stress. Easier said than done. It is. I try not to take stress, but your profession, doctor's profession, is where you cannot really avoid stress at any part of your life. But then, if you don't take stress, if you enjoy your work, maintain a healthy lifestyle. Don't worry about constipation. Constipation, the definitions which I have shared. If you are able to move your bowel twice a week, be happy with it. As and when you want to attend to passage of stools, you have places of convenience everywhere around. So don't bother too much. And Even after all this, if you, God forbid, do have to happen symptoms which might indicate piles, please go to a qualified doctor, get yourself examined so that you don't put your life into danger. Don't give that excuse of I was too busy working, I couldn't attend. I was too busy working, I couldn't get treated. I was too busy working, I didn't get relief for my surgery. No, that's not done. Look after your body, respect your body, the body would respect you back. Don't get into a rat race. There's no race. It isn't worth it. The time that we have seen in the past 2 years during these COVID times, nothing, there's no certainty for anything. Enjoy your life, enjoy your work, and go for medical help as and when you need it. That is what I would want to tell my young friends, because I see, sir, they are young achievers at this age. The I see professionals, at the age where we had not even started earning. We were still on pocket money from our parents. So the early success comes with a lot of stress, and stress precipitates medical diseases, not just piles, everything else. So look after your health in general, look after your body, respect your body, and expect the same from your body then.
Thanks a lot, Dr. Harsh, for this wonderful evening spent. I hope our viewers would be able to, take home most of the messages. And for our viewers, if you like this video and interaction, I urge you to, click on the like button and subscribe to the Practo YouTube live videos. And Dr. Harsh, it was a pleasure talking to you, and we look forward to, collaborating with you again in the future.
Thank you,
Thanks a
Dr.
lot.
Rajat. It was a great evening. Thanks a lot. And I'm once again sorry for the initial glitch during the presentation. I would ensure that this doesn't happen next time. Thank you very much. Thank you, viewers. Thanks a lot. Thank you, Dr. Rajat.